Welcome back to another edition of What's Next Longevity Deal Talk. This episode is made possible by the What's Next Longevity Venture Summit, co-hosted by Mary Furlong and Associates and the Age Tech Collaborative from AARP. It's coming up at UC Berkeley in California, June 16th through the 18th, with academic partner Citrus. We have some exciting news about the summit for you. I'm Fred Fishkin, along with Mary Furlong. Hi, Mary.
Hi, Fred. I can't wait to share some of the news with everyone. This is our 23rd year of bringing together top industry investors, entrepreneurs, thought leaders, analysts, partners, and media. It's hard to believe. It's really grown, and we have another dynamic agenda.
It starts with a series of boot camps on day one, including how to work with the NIA, some lessons from those who have received grants, and then something really unique, Mary, the opportunity to earn a certificate from Citrus Health at UC Berkeley in AI.
Yes, we'll have use cases in AI that include home care, senior housing, healthcare. And we have a phenomenal group of experts from Citrus, Meta, and various business schools.
Now, that is on the afternoon of the 16th and does require a separate $99 registration. Certainly very worthwhile and really exciting. And so is what we have coming up. We're going to be revealing the finalists in this year's $10,000 business plan competition. Stay with us for that. But first, we want to meet some of the amazing companies and entrepreneurs who have participated in the competition and learn what it has meant and where they are today.
The first people to meet are Natasha and Chris Ashton. They have an amazing success story. Even though they weren't the competition winners, they were one of the most successful companies that have come out of the competition. And where are they now?
We currently live on a residential yacht and have been traveling around the world for the last 2.5 years. By way of educating our youngest son and showing him that there's a world beyond the bubble that we lived in Philadelphia.
And actually, I got to give a couple of talks on the ship, as well as Jeff Simmons was there too. So also people that you met through the competition. But tell us about your journey from England to Wharton and what your idea was way back 23 years ago.
So Chris and I decided to go to business school in the US. We harbored entrepreneurial ambitions, and we moved over from the UK in 2001, and with our 4 suitcases and a cat. And shortly after arriving in Philadelphia, our cat became seriously ill. And the night before our accounting midterm, we ended up at the University of Pennsylvania Veterinary Teaching Hospital. And $5,000 later, we were looking for pet insurance. And that was really the origin of our business, because we very quickly appreciate that there was little available, and what was available in the US offered little to no value. We were very familiar with pet insurance from Europe, where it was a very successful product. And looking at the US market and the spending on pets, we realized that there was an opportunity to bring a new product to market to offer better protection to American pets.
Tell us what happened from that point and how you got involved with the Longevity Venture Summit.
So we entered the Wharton Business Plan competition when we finished we were finishing our MBAs in 2003, and we were very lucky and we won that competition. And we also looked for other business plan competitions that were available. And we found out about the Mary Furlong sponsored longevity business plan. And we entered that, and we were very surprised again to be invited to present as one of the finalists. And we went out to San Francisco for that. We met Mary and Jeff Simmons and the whole group of people. Unfortunately, we only came second in that competition, I think.
Oh, but I think that fueled our desire to succeed. I think that really was an extra prod to prove that we had something really meaningful.
But most importantly, what came out of that competition was this focus, this renewed focus on the baby boomer segment of the marketplace. And that was a huge underserved market, especially in the pet insurance space. Yeah.
And it brought the AARP into focus for us, very keen focus. And it took many, many years of returning to the conference and engaging with various members of the AARP executive team. But eventually, we ended up with a partnership. I think it took 8 years, 7 or 8 years of persistence, but we eventually secured the deal with the AARP, and that was instrumental to the company's success and ultimately the very successful exit for us, because it really was sort of a landmark partnership for us.
And this was for Pet Plan, correct?
Yes, Pet Plan, now known as Fetch Pet Insurance.
And at the time, AARP was just beginning to have AARP services. So they were getting health insurance. That was a different division of AARP. And so when you think about the needs of older people, they need health insurance, they need dental insurance, and they need pet insurance because the cost of a pet can be a surprise when you're later in your life to take care of an older pet. But so you got that deal done, and I remember with you being there when that happened, and that became a very good deal for you and for them. But Chris, you also went across the country and navigated state by state insurance because you had to figure out, in the US, longevity isn't just something that comes out of the national government. It's something you have to know how to go to market state by state, correct?
Yeah, very much. That's a very good point. The thing with insurance and pet insurance is it's regulated state by state. So every state has a slightly different set of rules. So we had to navigate the licensing and then the actual marketing of the products in all the different states, which definitely was a challenge, but something that's a good barrier to entry at the same time as well.
And you loved building your team. I remember visiting the company. You were great at brand and you were great at culture. And so, did you miss that sense of community as a team when you sold the company?
Oh, we miss that desperately. I mean, it takes a village, and we had the most amazing village. We really did. A fantastic community of people who helped us grow the company and succeed in the marketplace. And I think ultimately that's what drove us onto this residential yacht, because it gave us back that community that we've been missing so much since we sold the business.
Ironically, there was a doctor I met on the ship, and she's a UCSF geriatric doctor, and she's gotten involved in some of our projects. So I love how this community keeps building and growing, and that you all stay connected. It means the world to us that you came back and come back as a speaker, but I'm sure you have advice to share for entrepreneurs and investors. What would that advice be?
There's always a way. You have to be persistent. And we were very creative in our approach to pet insurance. We didn't invent pet insurance, but we did it differently. We wanted to incorporate a sense of fun into it. And
I agree. I think persistence really is absolutely key. We've seen so many entrepreneurs give up just at the point where if they'd carried on, they would have succeeded. But I think one of the other really critical points to make is you need to be flexible. The ability to pivot is just as important as your ability to persevere, because when you're setting up a business, you write your business plan, you have a clear idea in mind, but you need to appreciate that the minute you launch your business, that business plan is something you have to throw out the window. You're constantly having to reinvent yourself. You're constantly having to maneuver. I mean, when we started out, we were not looking at baby boomers as a potential market. But by meeting you, exploring the market, getting a better understanding of longevity, it ended up becoming our very best audience for the product. So being flexible, being able to pivot is just as important, I think, as your ability to persevere.
And we were talking before, listening and learning from others is
Yeah.
so key. And that is a big part of what conferences like the Longevity Ventures Summit is all about.
Very much so. We learned a great deal by going to the conference over several years. We met a great group of people, all of whom gave us advice along the way. So yeah,
I think the most successful entrepreneurs tend to exhibit a healthy dose of curiosity. I think you have to be curious, you have to be a problem solver, you have to want to uncover and learn. And I think we never stop learning. I mean, one of the reasons again that we are where we are today is because we want to keep learning. We want to surround ourselves by bright, intelligent people, and always try and surround yourself with people who are brighter than you. That's what we've found. That's been key to our success.
which wasn't difficult.
No, not difficult. No,
Well,
I was going to
this,
say yeah.
this year we're going to go back to a university. It's UC Berkeley, and we're going to be offering our first certificate in AI and longevity in collaboration with Citrus. And then we have NIA just approved funding for this category. We have the latest research from ARP, and Age Tech Collaborative, of course, is our co-host. And then we've brought in really good boot camps, things like how to go to market in Florida. Lots of little riches in the niches. So you might need to know 1 in 6 people are in Florida. I need to go to that session. Or Jeff Zimmon has done a master class in doing research and then taking your research and having 500 groups cover the research that you did. So how do you build on your PR? So some of these skills are part of the skills that we're offering 23 years later from the community of people that have been there. I think we're going to see some wonderful business plans.
No, we're excited. We're excited to see again every year incredible businesses come out of your plan. So yeah, we're excited to see what this year holds, especially with the advent of AI.
And you were just a judge on the Wharton Business Plan competition.
I was, yeah,
as well. So it's fascinating to see the next generation and all their ideas. Many AI related, but many not AI related.
No, it's staggering. The talent out there is absolutely, it's humbling, really.
So tell us about winning, and then also what progress the company's made since then.
It was an exceptional experience. Thanks, Mary. Wouldn't have made it here if it wasn't for sort of the exposure we found there. Since then, a lot's happened. We've expanded the number of devices that are in the ecosystem. We just, in fact, this happened a month or two ago. We officially got a contract from the state of New York, where we are a vendor, a technology vendor that got selected for their new home enabling supports program, which is wonderful. We're now not only serving older adults and seniors, but we're also serving folks with physical and cognitive disabilities for the first time.
Let's tell our audience exactly what you do. Okay, so what is this?
Sure. Well, in a nutshell, Lotus is a wearable ring that controls objects at home by pointing. But unlike traditional smart home technologies, there's no app, no rewiring, and no Wi-Fi needed. And so at the moment, it's being used both with public sector and private sector to actually help people with limited mobility, folks who are deaf, hard of hearing, folks who are blind and low vision. We're even working with the Helen Keller National Center. And actually, most exciting of all, we've just now started working with universities that are now using it for also their dorms, which is very exciting.
So turning lights on and off, etc., and other things too?
Yeah, lights, fans, appliances, even the TV.
Wonderful. And of course, in the market, we see the disability market and the aging market coming together.
And now we have other sort of other entities, like one of our investors is AARP, amongst many others, And they have seen that it is also usable and beneficial for anybody. So, for instance, one of our most recent use cases has been pregnant moms.
Yes, that makes a lot of sense. I totally understand that. And of course, we're so delighted to have ARP as the co-host and title sponsor, and that they have invested in so many of these companies as well.
My background, I am from Lafayette, California. I went to Berkeley. I did bioengineering, and then Stanford did bioengineering and medicine. Our company was formed from a biodesign class around 2014. And we then, after the class, applied for and pitched at Mary's competition in Santa Clara University. At that time, we were focused on the idea of using UV light disinfection to disinfect catheter hubs to reduce peritonitis infections for home dialysis patients. And we won first place. It was amazing. She was the first $10,000 check in the company, and the company is still around and doing great. We have now 3 FDA approvals, 29 patents issued, and a series of venture capitalists, angels, as well as NIH, Department of Defense, and NSF funds who are supporting the company.
Julia, you have come back as to be on the angel panel because you also have an angel investing portfolio, right? And what are some of your insights that have come about from being part of the competition? Because part of it's the prize money, but the other part is the network of people you meet.
For sure. The network is completely stellar. And through my friendship with Mary, which we're from the same hometown, luckily we've been keeping in touch. And also I've been helping support and participating in the conference ever since I won back in the day. You know, the network has helped me increase my span of investor list. And luckily, since then, I'm also an angel investor, and I've helped a family office as well overseas for venture investing. So the relationships with various VCs in Silicon Valley, you know, have increasingly grown.
It's been one of the hallmarks of the Longevity Venture Summit and all of Mary's conferences is the networking that goes on, the connections that are made, and it sounds like it really helped you.
Yes, definitely. I think Mary is a super networker, and it's a gift that cannot be learned or really at school. It's one reason why we keep coming back every year.
And Julia, with the boomers turning 80 and so much home care needed, this is really something that's very useful and is going to grow over the next 10 to 20 years. Can you talk a little bit about the enterprise value of the company, how it's perceived today by investors? I mean, it's impressive that it started as an idea in a class, and now it's a real company with patents. How would you value it today?
So the last valuation, which we received from a third party and from investors who set the valuation, was at 12x what the first investor invested back when, shortly after we had the Boomer Summit. So the company has grown 12 times since then. And we have just recently received our latest FDA clearance a few months ago, and looking at launching our first clinical studies this coming year to help reduce infections for hospital patients.
So happy to have you back. Julia will be in Berkeley working with Citrus at UC Berkeley. So we'll see you June 16th, 17th, and 18th.
Fantastic. We look forward to seeing you there.
Tell us the year you won and what the company does and where it is now.
So we won in 2021, and it was a really great experience. Alva Health is dedicated to developing a wearable device for real-time stroke detection. So our solution consists of non-invasive wearables with cloud-based monitoring using AI and machine learning algorithms. And what we do is we monitor the onset of stroke and then connect patients with 911 emergency medical responders.
Well, I understand why you won. Yes. So you got the $10,000 prize and hopefully got to meet people network with people from the conference.
So the conference was really unique because it really brings together experts in this longevity space, which is pretty unique in and of itself. You're talking about a very different population than a typical healthcare conference. You know, it was a really great opportunity to network with experts, with some of the investors, as well as with peers, some of the companies that were part of the program, and we also connected with several experts in the aging in place space, where we had opportunities to have in-depth conversations. You know, it was really great validation to be recognized by this community.
Absolutely. It's quite a group of winners we have. Some have grown to $100 million companies. We're pleased to be partnering with Citrus at UC Berkeley this year as our academic partner. We'll be covering topics like how to get FDA approval. This is a company that we are very proud of. They are working to solve healthcare language barrier issues. They really impressed me and all of our judges. Fred, why don't you make the introductions?
From Lexi, Lexi, co-founder Sid Hi, Sid.
Hello.
Great to see you. And co-founder Lynn Pham. Hi, Lynn.
Hi, everyone.
So before we talk about the competition, let's tell everyone what Lexi is and the story behind it.
So Lexi stands for Lexicon, which represents a vision of redefining healthcare communication starting with language. Lexi, we enable healthcare staff and providers to speak any language so patients can speak their own native language.
So Lexi originate from one of the research projects at Harvard where Sid and I had did our master in design engineering. We had a mission of improving healthcare outcome for the elderly immigrant community, and we realized that language barrier is one of the biggest challenges for the immigrant community to access care as well as other part of the quality of life. And for that, we joined force together along with other students from 5 different Harvard schools and built Lexi from the ground up. And since we graduated from last year and won the page competition, we've been operating for over a year now.
Just wonderful. Tell us a little bit, if you can, about the inspiration, Lynn.
Yes, of course. So our team is made up of immigrants and children of immigrants, which means that we ourselves have either experienced language barriers or have seen our family members experience language barriers. So I was born and raised in Vietnam and moved when I was 18. Of course, I struggle with language barriers, but what I realized is that the Vietnamese American community here, over 50% of them don't speak English, especially the elderly community. And with that, they always either have to rely on their family member whenever they seek care, or they would have to rely on remote interpreters to help advocate for their health. And that leads to a lot of gaps in care, a lot of preventable medical errors, and also longer length of stay. And we hope that Lexi can provide an affordable alternative solution to bridge that language gap.
Tell us how you've been bringing it to market and where it is today.
I think after Boomer Venture Competition, it really opened up a lot of doors and opportunities for us. After that, we've been expanding and working very closely with community health centers across Massachusetts. We're live at 5 different health centers. We're working very closely with all stakeholders, with community healthcare workers, with patients to deploy our solution. And we have done over 90,000 minutes of AI medical interpretation. We've done over 3,000, 15,000 sessions, and we've been impacting a lot of lives.
And this is done using AI. Step us through who your customers are. Are they medical professionals?
So for our solution is an AI-based medical interpretation solution, and it is used by the care teams in community health centers, hospitals, and other healthcare facilities. And for a patient who don't speak English well, they will need interpretation or someone who help them communicate at every single step of the way. That means whether it's through the phone line, at the front desk, with the nurse, the staff, the MA, the doctors, or even at the pharmacies, and even after visit to be able to understand their care. So the tool is actually used across the patient care journey from before they check in at the front desk to discharge and follow up.
Talk a bit about your experience with the competition. Obviously, it was a good experience. You won. and what it has meant for you.
Yeah, absolutely. We thought it was an amazing experience. Of course, winning is great itself, but I think what the best part of it is the opportunity to meet so many like-minded and shared mission founders, entrepreneurs, investors, and advisors. We got to meet other amazing competitors as well during our pitch competitions, and one of them was actually in the same language access space, which we now have become very good friends with, and we have learned a lot from each other. Beyond that, we also from winning the Boomer competition, we also got a lot of interest from investors as well, which then helped us which led us to successfully raise our pre-seed round later that year.
Sid, you want to tell us more about where things stand in terms of the funding of this whole venture?
So as Lynn said, like just getting the credibility and getting the non-dilutive grant was really essential for a bootstrap company at that stage. That really helped us to continue build the product, get more contracts, which enabled us to raise a pre-seed round. We ended up raising an oversubscribed round of $1.4 million with mission-aligned VCs and angels, with which we are expanding language access across different health centers.
And are you still in the process of raising capital?
So right now we have enough runway already, so we have closed our pre-seed round, but we are always open to chat with strategic and mission-aligned investors. If there's anyone that would like to join us along the way, please feel free to reach out and chat, and we'd always love to learn more about them.
Just terrific. And I loved what you said about the connections that are made, because really that's what the Mary's conferences are all about at the heart of it, bringing people together, this whole community, the longevity community and the age tech community. And so many people have talked about the value in the connections that are made.
Absolutely. I think that it has been so valuable, and we are still in contact with a lot of people that we met at the conference as well. And we are also very excited and looking forward to this year's conference as well.
So congratulations again to the Lexi team.
We are quite simply pioneering the restoration of balance and mobility in older adults, right? If you think about a loss of balance, mobility is one of the most visible, it's one of the most debilitating, it's certainly one of the most costly signs of aging, right? But despite that, until Dersantis came along, there had never been an easy-to-use device that you could use for early detection, right? To know that your balance is starting to decline. And even if you had access to the really expensive clinical equipment that could do that, there was then no non-surgical option to actually restore that last balance. So we have solved both problems. And it all started 4 years ago as we were wrapping up at the M-Hub Medical Device Accelerator in Chicago. And we met Mary, and Mary said, you should come to our longevity conference, and we did. And that has put us on a something of a rocket ship. Literally, because shortly after that, we received sizable funding from the Canadian Space Agency to address the challenge of the accelerated aging of the human balance system that's triggered spaceflight. And it was actually that research that led to the discoveries that we're now productizing to restore balance that's been disrupted by the normal aging processes that impact all of us.
And the seeds included, of course, winning the business plan competition. $10,000 went with it, but the summit is much more than that. It's the people that you meet, the discussions that take place, and the people that see you with your presentation, right?
Yes, I mean the entire ecosystem is there, whether you come at it from the longevity business angle or the more clinical health span angle, or heavily business focused age tech angle. Everybody is there, and the level of interaction, the willingness to explore what's next, right? Hence the name of the conference. What's in the pipeline that we can leverage for the ultimate goal, right? We have a rapidly aging population, and we're not doing everything that we can and should do to optimize their health span.
So where's the company today, Don?
So we have been making slow, steady progress. This is we are, after all, a medical device. It's all about clinical evidence and then real world evidence. We now have 4 years of incredibly demonstrative clinical and real world evidence, and we're about to embark on the final step. But we had our what's called a pre-sub meeting, pre-submission with the FDA at the end of last year. We presented all of our data. They received it very, very enthusiastically. They've given us a very broad indication for use. Our device is for adults over the age of 50 with indications of balance decline with a vestibular component. That indication of use addresses 80 million people in the US and Canada. And what the FDA told us was very exciting was the fact that we have this very sensitive early detection. So long before you know your balance started to decline, we can identify that, and we can restore it small piece by small piece so it never gets big. So we're now raising, big shout out to all you investors in the crowd. We're raising our second financing round to fund that pivotal study. The FDA is only requiring 3 study sites. We have our study sites selected around the country, one in Canada, and 50 people per site. So the minute we close our next funding round, we are 1 year away from FDA, and we're doing Health Canada in parallel. And with
that's amazing progress, and love how it helps the lives of older people.
And that is really at the heart of the Longevity Ventures Summit. So on to the finalists in the $10,000 business plan competition. Through the years, Mary Furlong and Associates has helped to identify and support innovations that have become the success stories in age tech. $230,000 in funding and untold connections have provided the launch pads. The 2026 business plan competition has attracted 80 applicants from 8 countries, 24 states, and the District of Columbia. Many are from leading institutions: Stanford, Harvard, MIT, Johns Hopkins, UCSF, and more. 55 of the 60 include a focus on health-related AI and analytics. Other leading areas include care services, social isolation, mental health, remote patient monitoring, fall detection and prevention, and cognitive fitness. This year's finalists are Health Tequity, Coralum, Lucidify, Dabble Health, Accelera, and Kubo Care.
Congratulations to the finalists, and the competition at the summit should be amazing. And we will be revealing the winner of the 2026 John Hopper Impact Award by Ziegler as well. It has become so meaningful for us to remember the work of John Hopper by recognizing exceptional entrepreneurs who have focused on solutions to improve the lives of older adults. John was a true pioneer and leader and is deeply missed.
Mary, there are so many reasons to attend, but I think perhaps most important of all are the connections that are always made. We've heard that over and over again.
And they're truly global, and they're long-standing. It's always heartening to learn about those connections and how valuable they can be. So we hope to meet many new friends, find old friends, and watch the new trends in the industry.
So learn more and register now, better not wait, at longevityventuresummit.com. And don't forget to sign up for the AI certificate program from Citrus 2. Thanks to all of the summit sponsors, you see them here, and to all of you for spending time with us once again.